Hi friends, I am Dr. Makaran Salunke, consultant physician practicing in Thane. Today we will be discussing about hypertension. Hypertension is the pressure exerted by the blood against the inner walls of the arteries. So normal blood pressure is around 120 by 80 systolic. So 120 is the systolic and 80 is the diastolic BP. For all routine purposes, we try to keep the BP less than 140 by 90. So what is the systolic BP? That is 120 for normal terms. It is the pressure exerted by the blood against the inner walls of arteries when the heart is contracting. In diastolic BP, that is the lower part of the BP, that is 80 mm approximately, is the pressure exerted by the blood against the walls of the arteries when the blood vessels relax. What are the risk factors for hypertension? First is age. Obviously, with increasing age, there is a high tendency for increased BP. Family risk factors. Patients with parents, siblings with history of high BP are more prone for hypertension. Diet. A diet which is more of sodium, less of potassium, again increases the risk of BP. Increased quantity of junk food, outside food, preserved food, processed food increases the risk of BP. Lifestyle. Patients with risk of sedentary lifestyle are more prone for high BP. What are the symptoms of high BP? So hypertension usually is asymptomatic, less than 50% of patients presenting with no complaints. The remaining 50% will present with headache, giddiness, syncope, exertional chest pain, breathlessness, or symptoms secondary to their complications, like patients with cardiac symptoms of acute MI, patients with symptoms of acute left ventricular failure, patients presenting a stroke with either slurring of speech, deviation of mouth, weakness in one side of the limb, imbalance while walking, patients presenting with visual symptoms like blurring of vision, loss of vision, patients presenting with renal involvement, presenting a swelling of face, legs, decreased urinary output. So, what are the ways by which we can reduce BP or control BP? So, the four pillars of hypertension treatment are mostly diet, exercise, drugs, and follow-up. So, a diet which is more of potassium, less of sodium, less of processed foods is what helps in reducing the BP. Exercise, a daily 30 to 45 minutes of walk helps to reduce the BP by at least 10 to 12 mm of mercury. Patients with hypertension need to show the consultant physicians, cardiologists for BP control, take medications as advised by the doctors regularly. The most important part of the treatment is follow-up. Patients usually being asymptomatic tend to lose follow-up, tend to stop drugs intermittently, which is not appropriate. Routine follow-up, routine BP monitoring at home and at office places as well as in the clinic by the doctor is essential for the treatment of hypertension. So the ultimate goal of treatment of hypertension depends on your diet, drugs, lifestyle and proper follow-up. Thank you.